Hi all, welcome to another video of NS Pharma. Today we will see important multiple choice questions from Pharmacology chapter Antihypertensive drugs. As you know, this chapter is very important for most of the competitive exams. There will be one or two questions from this chapter, so you have to study this chapter very well. Then if you are watching my video first time, then please subscribe the channel first of all, and also press the bell button so that you will get the notification whenever I upload new videos. Now we will move to the first question of this video: the antihypertensive action of calcium channel blockers, CCB. Antihypertensive action of CCB, calcium channel blockers, is characterized by the following, except it is asked for the question is asked for the which of the following is not a characteristic of CCB, calcium channel blocker. Option A, delayed onset, blood pressure starts falling after 1 to 2 weeks of therapy. It's saying that option A is saying that delayed onset, after you take 1 or 2 weeks CCB, then only the blood pressure will start to fall. That was the first option. We'll move to the second option, lack of central side effect. That's correct. No compromise of male sexual function. That's also correct regarding CCB. Safety in peripheral vascular disease. This is also correct. So the wrong answer here, the question, the ask for the wrong characteristic, not the characteristic of CCB, or the right answer here is option A. That is, the anti-CCB don't have any characteristic like delayed onset. That is, blood pressure start falling after 1 to 2 weeks therapy. So this is here the right answer. All are the characteristic of CCBs, calcium channel blockers. Now we will move to the next question. Question number 2. Persistent dry cough may occur as a side effect of the following antihypertensive drug. This one we already discussed in the chapter AC renin angiotensin system. In that AC inhibitor, when we talked regarding HC inhibitor, we discussed that AC inhibitor have the side effect of it will cause persistent dry cough. So here the options are enalapril, atenolol, diltiazem, Methyldopa. Here AC inhibitor is enalapril, so the correct answer here is option A, enalapril. You can watch my previous videos by clicking that videos of my channel, and also you can check the playlist. Also in the playlist there are pharmacology, separate pharmacology, pharmaceutics and pharmacognosy, all are there. So you can check subject wise also, and also each chapter wise also I discussed, so you can check it there in the playlist also. Now we will move to the third question, question number 3. Loss of taste sensation can be side effect of the following antihypertensive drug. Loss of taste sensation. This question was repeated in the anti-Parkinsonism video. I already discussed that. In that I gave 3 examples for this one, loss of taste sensation, but here is specifically asked for the antihypertensive drug, so we have to opt for the antihypertensive drug. Options here given are clonidine, captopril, verapamil, prazosin. The correct answer for this question is captopril. There we discussed the different drugs like levodopa will also cause us the same problem. This one, taste sensation, loss of taste sensation. Another one was penicillamine. Penicillamine was also causes loss of taste sensation. So captopril, levodopa, penicillamine, all are causes loss of taste sensation. Since it is asked antihypertensive, here you had to go for captopril. Now we will move to the fourth question. Higher incidence of myocardial infarction and increased mortality has been noted with the use of the following antihypertensive drug. Higher incidence of MI and increased mortality has been noted with the use of following antihypertensive drug. Options are nifedipine, verapamil, diltiazem, lisinopril. The correct answer for this question is nifedipine. That is a calcium channel blocker. Calcium channel blocker. It's coming under the class of CCB is classified into 3 types. I think you know this one. Out of this, in the CCB, there is a DHP category, that is dihydropyridine derivative. In that, its dipines all are coming under dihydropyridine derivative. That is amlodipine, phenodipine, nifedipine, all are coming under this category. But nifedipine particularly, not all the DHP, nifedipine particularly causes, there is a higher incidence of myocardial infarction and increased mortality. Not all DHP, this nifedipine particularly. Now we will move to the 5th question of this video. Furosemide is to be preferred over hydrochlorothiazide when hypertension is accompanied by. Furosemide is the diuretic of choice in case of congestive heart failure. We discussed in that CHF already. This one we already discussed. Furosemide is the preferred diuretic in case of CHF. Here the question came like furosemide is to be preferred over hydrochlorothiazide when hypertension is accompanied by. Options are asthma, hyperuricemia, option C diabetes, option D congestive heart failure. The correct answer for this question is option D congestive heart failure. We will move to the next question, 6th question. Thiazide diuretic. This one diuretic we class furosemide. I think you know this one. Furosemide is coming under high ceiling diuretic. Hydrochlorothiazide is coming under thiazide like diuretics. Thiazide diuretics. Here 6. Thiazide diuretics do not potentiate the antihypertensive action of one of the following drug. Thiazide diuretic do not potentiate the antihypertensive action of one of the following drug. Options are metoprolol, nifedipine, hydralazine, and the last option D captopril. Options are metoprolol, nifedipine, hydralazine, and captopril. Here thiazide diuretic do not potentiate, so it should no need to give along with this medicine. Which of the following, this out of this one medicine is the one antihypertensive medicine, along with we cannot use thiazide diuretic. Which is that? The correct answer for this question is B nifedipine. Along with the nifedipine, no need to use thiazide diuretics. Next question number 7. As antihypertensive, the thiazide diuretics have the following advantages, except the advantages of thiazide diuretic are following, except options are there: high ceiling antihypertensive action. Option B, absence of CNS side effect. That is correct. Absence of tolerance development. That is also correct. Low cost. Normally the prices of the antihypertensive thiazide diuretic drugs are very low comparatively. So here the correct answer for this question, that is not the advantages of thiazide diuretic is option A, high ceiling antihypertensive. This thiazide diuretic is not a high ceiling antihypertensive. Question number 8. In the treatment of hypertension, the beta adrenergic blockers have the following advantage. Beta blockers have the following advantage. They have minimal effect on work capacity, sleep quality, and libido. They do not cause postural hypotension. Option C, used alone, they have high ceiling antihypertensive efficacy. And option D, they can be used in combination with any other antihypertensive drug. Here the correct answer for this question is they do not cause any postural hypertension. They do not cause postural hypotension. That is the beta blockers advantages in case of hypertension. They do not cause postural hypotension. Beta blockers do not cause postural hypotension. Now 9th question of this video. The following antihypertensive drug has favorable effect on plasma lipid profile. That is, the antihypertensive drug which will help to decrease the low density lipoprotein LDL, and it will also reduces the triglyceride level also. That's what triglycerides. It will decrease LDL as well as triglycerides level, which is that antihypertensive drug. Options are prazosin, propranolol, hydrochlorothiazide, furosemide. The correct answer for this question is prazosin. Prazosin will cause, it has antihypertensive action. Along with that, it will help to decrease LDL as well as low density lipoprotein as well as triglyceride level. Now we will move to the 10th question. The following drug has been found to improve urine flow in elderly males with benign prostatic hypertrophy, that is BPH. In case of BPH, if a patient is having problem of BPH, then which of the medicine will improve his urine flow? Options are nifedipine, prazosin, disopyramide, imipramine. The correct answer for this question is option B. Prazosin will help in the BPH. Prazosin is the correct answer. Prazosin. Now we will move to 11th question. Rebound hypertension. This one you had to note it down. Rebound hypertension is on sudden stoppage of medication is most likely to occur with. This is one important question. Rebound hypertension is the side effect or on sudden stoppage of a medication is most likely to occur with. Options are hydrochlorothiazide, prazosin, clonidine, lisinopril. The correct answer for this question is the clonidine. Clonidine will cause rebound hypertension. Now 12th question. Methyldopa lowers BP. Methyldopa lowers blood pressure by. This is the drug of choice in case of pregnancy as antihypertensive drug. This one you had noted down. Methyldopa is the drug of choice in case of pregnancy for the hypertension. Now the question is Methyldopa lowers the BP by. The mechanism it's asking, the mechanism of Methyldopa. Options are inhibiting dopa decarboxylase in adrenergic nerve ending. Option B, generating alpha methyl noradrenaline in brain, which reduces sympathetic tone. Option C, generating alpha methyl noradrenaline, which acts as a false transmitter in peripheral adrenergic nerve ending. Option D, activating muscular dopamine receptors. The correct answer for this question is option B. It generates alpha methyl noradrenaline from the methyldopa in the brain, which reduces sympathetic tone. Now we will move to the next question, question number 13. Long-term hydrolyzing therapy is likely to cause. Long-term hydrolyzing therapy is likely to cause. Hydrolyzing with these things we will see in the last of this MCQ, the different drugs used for the hypertension, the classification of these drugs we will see in the after the MCQ. So here the question, long-term hydrolyzing therapy is likely to cause. Options are gynecomastia, thrombocytopenia, hemolytic anemia, lupus erythematosus. The correct answer for this question is lupus erythematosus. Lupus erythematosus is the side effect of hydrolyzing therapy, long-term hydrolyzing therapy. Now we will move to the 14th question. The following antihypertensive is used topically to treat alopecia areata. Alopecia. The antihypertensive, which is an antihypertensive which is used topically to treat alopecia areata. I think you know this answer. This is very simple answer. Option A, hydrolyzine, prazosin. Option C, minoxidil. Option D, indapamide. The correct answer for this question is minoxidil. Minoxidil it's coming in the brand name Regain. Different brands are available. Even though Regain is comparatively the branded item, it's coming in two form, 2% as well as 5%. 5% is especially for the men. 2% can be used for men as well as for the women. It's for used to treat alopecia areata. Now we will move to the 15th question. The following vasodilators act by opening potassium channel in the vascular smooth muscle? The following vasodilator acts by opening potassium channel, that is potassium channel opener in the vascular smooth muscle. Options are: option A, dipyridamole; option B, minoxidil; option C, diazoxide; option D, both B and C. So the options are dipyridamole, minoxidil, potassium channel opener, okay, option C, diazoxide; option D, both B and C. The correct answer for this question is option D, both B and C, that is minoxidil as well as diazoxide is coming under potassium channel opener. Now we'll move to the 16th question. The following antihypertensive drug tends to lower plasma renin activity. The antihypertensive drug which tends to lower plasma renin activity. Before this, we discussed which will lower antihypertensive, which will lower LDL as well as triglyceride. Hope you know this one. That was prazosin. But here the question was, it will lower plasma renin activity. Options are clonidine, hydralazine, nifedipine, captopril. The correct answer for this question is clonidine. Now the 17th question. The following antihypertensive combination is irrational and therefore it should not be used. The combination which should not be used is option A, nifedipine along with the hydralazine, amlodipine along with atenolol, enalapril and clonidine, enalapril and hydrochlorothiazide. The correct answer for this question is nifedipine with hydralazine. Nifedipine cannot be used along with the hydralazine. Now we will move to the last question of this chapter, angiotensin converting enzyme inhibitor, that is ACE inhibitors. ACE inhibitors are contraindicated in options: high renin hypertensives, diabetic, congestive heart failure patient, pregnant woman. The correct answer is pregnant woman, because the use of ACE inhibitor in the pregnant woman, it will cause us fetopathic. It is fetopathic, or it will cause us death of the fetus. Now we will see some the classification of the medicines. What are the medicines used for against hypertension? First of all, the classification. First of all, diuretics. Diuretics are there. This one we know that thiazide diuretics are there. That is thiazide diuretic. That means hydrochlorothiazide, indapamide all are coming under thiazide diuretic. Next one is high ceiling diuretic, that is furosemide. Then potassium sparing, spironolactone and amiloride. Now the second option, ACE inhibitors, that is captopril, enalapril, lisinopril, etc. The third option, ARBs, angiotensin receptor blockers, that is losartan, candesartan, irbesartan, valsartan, telmisartan, all are coming under this class. The fourth option, calcium channel blocker, that is CCB, especially verapamil, diltiazem. All classes are using this DHP, especially that is nifedipine, felodipine, amlodipine, all the dipines. But in case of nifedipine, there is a chance of more adverse reaction. And the fifth option, beta blockers. So first of all, diuretics, AC, second one AC inhibitors, then ARB, that is angiotensin receptor blocker, then CCB, calcium channel blocker, then beta blockers. Beta blockers like propranolol, metoprolol, atenolol are using. Then alpha and beta blockers combinations, alpha beta blockers, that is labetalol, carvedilol are coming under this class. Then alpha blockers are coming. Alpha blockers like prazosin, terazosin, doxazosine are coming under alpha blockers. Then central sympatholytic, that is clonidine, Methyldopa are coming under central through central action, central sympatholytic. Now vasodilators, the last option, vasodilators. This hydralazine is coming under this one, hydralazine, minoxidil, all are coming under this classification, this class, and sodium nitroprusside is also coming under vasodilators. Okay, so what are the class? Diuretics, first one is diuretics. The examples are thiazide and high serine and potassium sparing, all are using hydrochlorothiazide. Furosemides, spironolactones are example. AC inhibitors, examples are captopril, enalapril, lisinopril. ARB, that is angiotensin receptor blockers, examples are losartan, candesartan, etc. Then CCB, calcium channel blockers like verapamil, diltiazem, amlodipine, etc. Beta blockers like propranolol, atenolol, metoprolol, etc. Alpha and beta blocker activity, that is labetalol, carvedilol. Alpha blockers, prazosin, terazosin, etc. Central sympatholytic, that is clonidine, alpha Methyldopa, etc. Then vasodilators, examples are hydralazine, minoxidil, diazoxide, sodium nitroprusside. So these are the important points regarding this chapter. So thank you guys for watching this video. Hopefully you like this video. If you like, please make a thumbs up and also subscribe the channel if you didn't until now. Thank you.